Aging, as we all know, is a huge issue. There's not been an effort to have a kind of a common purpose or a common strategy and to find ways to collaborate and coordinate and look for efficiencies and all those great things. So that's what my job is, to try to figure out what the state does and what the state ought to do to address this challenge we have of the fact that forever more of us are going to be older than have ever been before.
Come in. Hello.
Hi, Constance.
Hi.
How are you?
Oh, fine.
Primary care providers are uniquely positioned and uniquely challenged to think about the influence they have,
So we got paperwork to do.
All right.
not just tend to the immediate healthcare challenges that may be presenting themselves, but to understanding and facilitating the underlying conditions and the underlying life situation that are frankly unique challenges to this stage of life.
Okay, go ahead and sign right there.
Seniors are going through a life transition that is very important to recognize. They're not working, they're dealing with lots of family transitions, they're thinking about living independently versus not living independently. And I think the perception is that seniors' lives are pretty carefree and open, but I think that the opposite is true a lot of the time.
So do you have any questions for me?
Not a thing. You did a great job, honey. I just
told you
understand everything.
Okay.
We have this program in our Human Services Department that is the Area Agency on Aging, which works to provide supports for people continuing to live in communities.
The Area Agency on Aging is a great place for people to start. And so most communities will have an Area Agency on Aging that they can at least call, even if it's not within their community, to find out what resources are available.
Our agency, the Area Agency on Aging, has a plethora of programs that help seniors over 60 maintain in their home. You look great.
Oh, thank you.
Good. We're going to give you state health insurance programs that's going to help you with your medications to save you money. We're going to provide you with food. We're going to provide you with transportation. We're going to make sure that you can get to your doctors, to get to the grocery store, have a nutritious meal, and at the same time be here for you to talk to.
As a senior service coordinator, that role oftentimes puts me in private homes, working with elders and families to try to figure out how to keep them at home. I like to sit down with an elder and become extremely comfortable with them and say, okay, tell me about your situation. Tell me what's changed in your life. Then it's my job to go out and say, I know there are other agencies. I know that I can work with hospice, home health care, private pay agencies, Medicaid, Medicare, services through our agency to put those pieces of the puzzle together and keep that person at home, because we all want to live at home. I mean, there's nothing like our own bed, our own pillow, our own blanket.
With regards to evaluating kind of the whole patient when they come in, it's probably something that many primary care doctors could put a little more focus on. I think that many seniors have a number of medical problems, and so what frequently happens is those take the forefront of visits, and maybe we forget to ask questions about some of the functional issues about driving and access to food and falls. I think one thing that a provider can do differently when getting to know a senior patient is actually consider a home visit.
Okay, so where are you going to use your tickets for this time?
The dentist.
All right, so let's get started and get you signed up.
So you get a lot of information about somebody's functional status and their living situation by being in their home, more so than you're going to get in an office visit.
We'll sign that for me right where it says from.
When I do a home visit, I do follow a template that looks at access to nutrition, what their transportation is, what their fall risk is in the home. For me, building a template helps to cue making sure that I do a full assessment when I'm in the home. or in the office if I'm unable to go to the home.
Thank you, Linda.
And next time I come in, I want a candy bar, okay? Or half, how's that?
It's super cool to have that clinic call and say, I've got this patient really struggling, maybe your meals would help. Maybe they need Medicaid services, they're struggling to pay their bill here at the clinic. Have you been out to see them? That team working together, because we all want our clients, our patients to do well at home, so why would we not come together as a team?
I don't want to get embarrassed, you know. We call this socialization, right?
I've really come to understand that social isolation is probably among the biggest challenges we face. Whether someone can stay engaged in their community or whether they become more and more isolated, whatever the cause of the social isolation, it results in serious health challenges, emotional challenges, mental health challenges, and these are the precursors of a downward spiral, really.
I think it's 1 out of 3, 1 out of 6 seniors every day have to decide about eating, taking medication, or pay rent or utilities. We're there to hopefully offset those costs and fears and the depression that goes along with it, because someone else is reaching out to help them, which helps them longevity in life, keeps them healthy.
This is not an easy challenge, but sometimes the answers are very simple. And usually they have to do with what's the humane, human level, person-centered thing to be doing. And so if someone is in need, not just saying, oh, our time is up, thanks, we'll see you next time, but it's finding a way to act in the moment or be able to hand the patient off to someone who can act in the moment, or certainly following up. We need to hear from the providers in those examination rooms. And while we know in general what needs to happen, how to make that happen and how to provide support and encouragement for making that happen, everybody needs to be in on that conversation.
See you later, okay?
See you later. Have a good day.
Alrighty.
Bye-bye.
Bye.